Let's turn our attention to the most common condition, diabetes mellitus. Having both cardiovascular disease and diabetes is a very common and particularly deadly combination. These two diseases share a multitude of common risk factors. India has the largest number of people with diabetes in the world, with an estimated 19 million in 1995 and projected to reach 57 million in 2025. Adults with diabetes are 2 to 4 times as likely to die from heart disease compared to adults without diabetes. In addition, heart disease and stroke account for nearly 2/3 of all deaths in people with diabetes. The good news is that type 2 diabetes mellitus, the most common form of diabetes, is a highly preventable disease because it is associated with many risk factors that can be changed or controlled. These risk factors include 1. Overweight or obesity. If the excess weight is most evident in the stomach areas as opposed to the hips, this creates additional problems because of the amount of body fat that's being stored in the tissues. 2. Physical inactivity. 3. High blood pressure. Worldwide, this is one of the most important and preventable cause of premature death. Even a blood pressure at the top end of normal range increases the risk. The 5th, high cholesterol. The risk of both diabetes and cardiovascular disease increases when the HDL cholesterol is less than 35 milligrams per deciliter. LDL cholesterol is greater than 100 milligrams per deciliter, or triglycerides higher than 150 milligrams per deciliter. The Diabetes and Cardiovascular Disease Initiative. The initiative has developed the ABCDEFs of risk reduction that encompasses both diabetes and cardiovascular disease. A stands for hemoglobin AIC and aspirin. The AIC target. It represents a long-term measure of the blood glucose control in your body. The goal is a hemoglobin AIC below 7%. This level of hemoglobin AIC prevents microvascular disease and may prevent cardiovascular risk as well. 2. The B stands for blood pressure control. The goal of blood pressure for patients with diabetes is 130 by 80 milligrams, which is slightly lower than the target for the typical heart disease patient, which is 140 by 80 millimeters mercury. C. C stands for cholesterol management and cigarette smoking cessation. Cholesterol management. LDL should be lowered to less than 70 milligrams per deciliter or even lower for individuals with diabetes and or cardiovascular disease. Cigarette smoking. Cigarette smoking greatly increases the risk of cardiovascular disease, and one should make every effort to quit smoking. D. D stands for diabetes and pre-diabetes management. It is recommended that patients with diabetes encompass lifestyle modifications to help them maintain their diabetes under good control and reduce the risk of suffering a major cardiovascular event such as heart attack and stroke. Not only that, one can even prevent diabetes if one follows a prudent lifestyle. E stands for exercise. Moderate intense aerobic activities such as walking, jogging or cycling is important as a risk reduction strategy for both cardiovascular disease and diabetes. A 30-minute brisk walk once every day will go a long way towards improving your health, controlling diabetes, preventing cardiovascular disease. F stands for food choices. Eat less food and make sure the food you do eat isn't overtly high in calories. Limit your intake of saturated fats and trans fats as well as cholesterol. Concentrate on a personal menu that features fish, lean meats, low-fat dairy products, fruits, vegetables, fibers and nuts. The fats you do consume should be mostly poly or monounsaturated fats, which are found in fish like salmon, olives, walnuts and liquid vegetable oils such as the soya bean, corn, safflower, olive and sunflower oils.